Okay, thank you all for coming today. We're very glad we have a great turnout, and we hope you are enjoying yourself. Today, Kristi and I are going to speak about pain and MS. We'll just wait till we get our slides. That's good. Okay, so pain can be located throughout the body. It's not limited to one area. Over 75% of MS patients will experience pain at some point in their life. We have divided up pain into acute, which is short-term warning of acute inflammatory process taking place. Also, there's intermittent and chronic. Chronic is long-term basis. Okay, pain is a warning sign that something that has occurred has been harmful to the body itself. There's maybe nerve damage, which is a result of alteration in the signal that is delivered for no apparent reason, may result in injury secondary to decrease or alteration in sensation. Types of pain, Kristi and I have divided up the types of pain into neuropathic pain, and then spasticity and muscle pain. First of all, Kristi's going to talk on neuropathic pain.
Hi guys, bear with me. I've never spoken in front of a group this large, so hopefully knowledge will prevail over nerves at this point. We'll see. So I'm going to be talking about neuropathic pain. It's a symptom that Melissa and I deal with on a daily basis with our patients in the MS clinic. If I were to ask you to raise your hands, patients who have experienced pain, I would imagine that it would be the vast majority of the group here. I won't ask you to do that though. So these are the types of pain that we're going to be talking about primarily today. The first three are rather short. I would say most pain generally falls into the last one, which is general dysesthesias, which is a big word for nerve pain. And I'll get into kind of the sensations that you feel with these types of pain. Dysesthesias is a distortion of sense, especially touch. It can be just light touch over just a light touch over your arm can induce a intense impulse, or it can be pain for no apparent reason. So neuropathic pain results from damage in the central nervous system as a result of MS lesions, either in your brain or in your spinal column. It can be very severe and disabling and can affect you functionally in your day-to-day life. That can also flow over into psychological impacts, particularly if you're dealing with depression. That can lead to social consequences, because if you're having pain, you don't want to get out, you don't want to function, you lose interest in things that you may have once enjoyed because you don't feel like getting out and participating in those events. Typically, neuropathic pain is described as a sharp shooting, stabbing, burning, sometimes so cold that it burns, and electrical sensations. And you can see some examples that I pulled off the internet of those types of sensations. Pins and needles is also a very common type of pain that you may experience. Usually it's not all that difficult to manage pins and needles. So now we'll move to Lhermitte's. Lhermitte's is an electrical shock sensation that is experienced whenever you flex your head down to your chest. It can send that sensation all the way down, typically to your mid-back or even down to your knees. This is a direct result of a cervical lesion. It can be intermittent. It can indicate active inflammation, though many times it is just a sequela of a lesion in that area. Now we'll move on to the MS hug. This is a squeezing, banding, tight sensation, girdling that is most commonly felt somewhere around the thorax. It's typically on one side or the other, goes from the front around to the middle of your spine, though it can go all the way around. And this is indicative of a thoracic lesion. Tic douloureux, or trigeminal neuralgia, is a semi-common pain that you may experience. It's a nerve-like pain. Again, that sharp shooting electrical sensation primarily occurs on Primarily occurs on one side of the face, typically unilateral, that being one side, and in a very distinct pattern that I'll show you on the next slide. It can be very difficult to diagnose. Many patients think that it is dental pain initially, and then when they go to their dentist, they can have several visits with their dentist and then work them up thinking that it's a root canal. I've even had patients that have had teeth removed and extracted because they thought it was a result of the dental pain when it's actually truly coming from the nerve. It many times is aggravated by simple activities that you do all throughout the day, such as talking, chewing, brushing your teeth. Even just a light brush along the outside of the face, such as wind blowing against it, can aggravate this type of pain. Again, it can be difficult even to diagnose and treat. Medications is primarily the main therapy and treatment for trigeminal neuralgia, though surgery is sometimes an option. Although it's not curative many times. Many times patients will get a little bit of a relief for 6 to 9 months and then the pain will come back. So this is a picture of kind of the zones. You have a facial nerve that has 3 branches. One that goes up towards your forehead, one that goes along your cheekbone, and then the other that goes along your jawbone. Typically, it presents in one of those areas, though it could be 2, and again, typically on one side. Now, this is the area where we have the most common pain. Piercing, lancinating pains that occur throughout the body and fluctuate with intensity, and many times without any apparent cause. And they can bounce around from your leg to your abdomen to your arm to sharp pains in your head. Again, presenting it the same, you see a theme, sharp shooting electrical sensations. One of the most common neuropathic pains, I would say, is a burning sensation in your hands or in your feet. And again, it can be so cold, can feel so cold that it feels like a burn. You want to avoid aggravators of neuropathic pain, which typically include extreme changes in temperatures, including heat and cold, fatigue, also will exacerbate neuropathic pain. Any type of stress on the body because of whatever's going on in our hectic lives, or stress internally, which results from illness or infection, can also exacerbate pain. Depression will contribute as well to reasons I mentioned before. Prolonged sitting or standing, so that will exacerbate pain. So you want to be sure that you get up and move around at least every half hour to an hour to get those muscles moving. Many times pain is worse at night, and that's primarily because whenever you're lying in bed at night or at the end of the day and you're sitting watching TV, you're more present with your body at that time than any other time of the day, and so you're more aware of these painful sensations. Don't always point to MS. We can blame a lot of pain on MS, this is true, but not always. So you have to kind of look at the whole person and everything that is going on. Some other causes of pain would be a nerve root compression from a bulging disc that can cause very similar pain. Gait compensation. So if you're weak on one side of your body over time, your body can have some secondary musculoskeletal changes from your MS, but it's not a primary reason for the pain. Can you guys hear me? Obviously, fracture can cause increased pain. Injury, and again, infection. Infection is a big one. Now we'll get into treatment of pain. As you can see, regular exercise and a healthy diet is a theme for today, and that maintains true for pain. Cognitive behavioral therapy is also very effective. Physical therapy or physical medicine, working with your physical therapist to maintain and develop an exercise program can help treatment for nerve pain. Of course, medications, and then treating the underlying disorders such as infections or depression. So, non-pharmacological treatments include, you can convert pain into pressure through various means. So say mild compression stockings on your legs if you have intense burning, sharp shooting pains primarily in your lower extremities, you can get some compression stockings, and that will just kind of trick the brain into thinking that it is more of a pressure sense rather than true pain. So you're just kind of trying to trick your mind. Again, exercise, general health and well-being. Ideally, you want to participate in a regular exercise program. The goal of a therapeutic exercise program really is 30 minutes 5 times a week. Now, some of you may say, there's no way I could do that, and that's fine. What you do is you set a goal that's reasonable for you, and even split the exercise up into several sessions throughout the day. You'll still get the cumulative effects on from exercise. Biofeedback techniques is a technique that your psychotherapist, a trained psychotherapist, can work with you over usually 8 to 10 sessions. And what they really do is try to help you, it's sort of mind over matter. They try to help you control your heart rate, your breathing techniques, as well as even sometimes your temperature changes in your body to help manage the pain. It can really change your beliefs on pain, can really change your pain experience. Whereas if you try to use distraction techniques that are many times very effective, that can decrease your level of pain rather than if you perseverate on the actual pain sensation and dwell on it. Meditation is very helpful, as you see my very zen guy over here relaxing. Breathing techniques and relaxation techniques are very helpful through distraction. And again, this goes back to being able to, when you're getting up, getting ready, getting kids ready to go to school, whatever your daily activities may be, many times you have less pain at those times of day because you have other things that are going on in your world and you're not as aware of the pain. Hypnosis is effective if you're open to it. And then also there's acupuncture, which is, you probably know, is a needling technique, and they have some dry needling techniques as well, which is developed in Eastern medicine, Chinese medicine. It's intended to restore the meridians. It's thought if these meridians are blocked, then it causes increased pain. I usually tell patients, try a few of these techniques, particularly acupuncture. Try going in for a few sessions, and then if it is effective, great, continue it. If it's not, then it's probably something that you should move on and try other techniques that are available out there.